Hi, everybody.
Hey, Jen Ritchie.
Good afternoon, everybody. How's the weekend going for you so far? You're winding it down. All good? Hi, Blaine. What's up? Good. Anthony's enjoying the summit. Awesome. It's fun. I'm looking forward to when we can meet together again in person. I met Ryan Glatt, our guest here, our speaker here at one of these events. Gosh, I don't know, 2 or 3 years ago. So it's nice to see you virtually, if not in person. Shall we go ahead and start, or do you want to give folks a few more minutes?
We can go ahead and get started.
Okay, super. I'll handle the honors of reading your introduction. Ryan Glatt is a personal trainer and a brain health coach with more than a decade of experience. He currently practices brain-based strategies for cognitive enhancement at the Pacific Brain Health Center in Los Angeles. Ryan has pursued education from the Amen Clinics, the Neuroscience Academy, the Academy for Brain Health and Performance, and the Masters of Applied Neuroscience program at King's College in London. Recently, Ryan has released the Brain Health Trainer course, which is the first comprehensive course to be released on the topic of brain health and exercise. Health and fitness professionals have the opportunity to join allied health professionals in addressing the major epidemic of cognitive decline and neurodegenerative diseases such as dementia and Alzheimer's disease. Although exercise has been proven to be beneficial to brain health and cognitive functioning, the precise exercise prescriptions are not clear to the general public or to the industries of health and fitness. This has led to further confusion and leaves clients, patients, and caregivers wondering if they're doing all that is possible to stave off cognitive decline. This session will review the research on how certain modalities of exercise can differentially affect the brain and provide an initial framework for the assessment and programming of cognitive health within exercise programming. And that is a very well done introduction to our speaker today. Here he is, Ryan Glatt, everyone.
Thank you so much, Jay. Much appreciated. Thank you, everyone, for coming today. It's an honor to present at my third Functional Aging Summit. Functional Aging Institute, I owe so much to them for giving me a platform to spread this message, a very important message about preventing cognitive decline and slowing cognitive decline through exercise. And so thank you, everyone, for being here and giving me a purpose, which is to share this message with you. Thanks again, Jay, for the wonderful introduction. My name is Ryan Glatt. I have a master's in applied neuroscience. I'm a certified personal trainer, and I'm a certified health coach as well. And I'm proud to call myself a functional aging specialist. If you are on the socials, you can follow me at glatt.brainhealth, where I sometimes post content. I need to do better at doing that. But thank you so much for being here today. I imagine that all of you are interested in this topic, which is why you're here. And I see a future for the fitness industry that is different than what we've been experiencing up to now. And the future I see is more focused on medical fitness and precision medicine. And when I say precision medicine, it's targeted to the individual goals based on some sort of markers of data. And we're using exercise to target individuals and individualize their exercise programs based on that data. A place where we actually do this is my place of work, where I am now, called the Pacific Brain Health Center in Santa Monica, California, where we incorporate an interdisciplinary team that includes psychology, neuropsychology, neurology, nurse practitioners, social workers, and I operate a medical fitness studio called the Fit Brain Program, which is basically a brain gym where people come to work out their brains and bodies simultaneously There's more individuals and facilities starting to incorporate these concepts like activate brain and body, which I'm really excited and honored to be a part of. And this is going to become more and more common. And so by being here, you are investing the time and interest and effort to actually being a part of the future, which is solving a problem that is actually very present. And it's not new. It's something that's been around for a long time now. But as the population grows in size and as we live longer, we have a significant exponential increase in the prevalence of Alzheimer's disease. Alzheimer's disease is a type of dementia that is the most common type of dementia. And you can probably, I'd like to see by hand raise on Zoom or something in the chat if you know somebody that is affected by Alzheimer's disease or dementia. I'd love to see who, okay, lots of hands go up. This is not surprising, but unfortunately is all too common. And that starts to make a lot of sense when you start to look at these statistics. And you probably know somebody who knows somebody with Alzheimer's disease or dementia. And you can raise your hand or keep your hand raised if you know someone with Parkinson's disease or multiple sclerosis or a mental health condition or someone who's noticed that their brain isn't working the way they want it to. So this isn't just about Alzheimer's disease. This is about issues of the mind and brain. Alzheimer's disease is one of the most common forms of dementia, and that's why we hear about it a lot, especially this week with a brand new Alzheimer's drug that just came out. We're not going to talk about that, but it's always in the press because it's so prevalent, it's so common. And so if we can agree that the biggest issues of our modern era and of the future are of the mind and brain, from neurological conditions to cognitive concerns to maybe just not feeling as sharp as you'd like to feel to mental health issues, we can all agree we're mobilized, we feel passionate and driven to do something about it. And as fitness professionals, we are in the helping profession. We are in the service profession. We want to help people. And so you're in this profession because of that. I'm sure you're in this profession for a lot of reasons, but we can all agree we want to help people. And so these clients that we've been working with for however long you've been working with them, they have a brain. And while they come to you for pain or weight loss or functional mobility, or just to be able to maintain enough function to be able to play with their grandkids, they also have a concern. And that concern is a concern of preventing dementia. And it's actually up there. It's the top, if not second to the top, or a tie with falls. We know that older adults or the aging population has a fear of falling, and that is a primary concern for them. We also know that they are very worried about developing cognitive decline and developing issues like dementia. Now, some individuals are really worried about this and some just think it's part of normal aging, but we're going to talk about what's normal and what's not in just a second. But it's also important not just to think about dementia and Alzheimer's disease. When we think of that, we have a representation of that in our head that maybe isn't the most accurate. We probably have a stereotype of what Alzheimer's disease or Parkinson's disease looks like. We're probably thinking of older adults and senior living that are in their 80s or 90s that are maybe staring out into space and not active in their day-to-day life, and they're not doing their activities of daily living. But that's actually not true. Well, it is true except in the later stages, but there's a lot of different conditions that affect brain health. And when I say brain health, I'm typically referring to cognitive impairment. There's a lot of conditions that affect cognitive impairment in the brain. The brain is the most sensitive organ in your body, and therefore we have medications affecting the brain. We have obesity and metabolic disorders. We have cardiovascular conditions. We have cancer and chemotherapy, something called cancer-related cognitive impairments or CRCIs. We also know that just going through the lifespan affects cognition in the brain. There's also more and more research coming out about how menopause and pregnancy affect the brain, and motherhood, and trauma, and depression. All of these things affect the brain. So we need to bring the brain into the conversation of health and wellness. It's not just about fascia and muscles and joint mobility and adipose tissue. It's also about brain health. So this is a part of the conversation for our scope of practice, but we also need to understand where people are at. Where are people in the trajectory of brain health and cognitive decline? Well, there's different stages of cognitive decline. Ideally, all of us and our clients and our friends, our family, our community members are on the top green line of this trajectory. This trajectory represents, the green line at least, the normal curve of cognitive aging. And just like every other system of the body, you can see there's a steady, slow decline. Aging is not something that can be denied. It's not something that can be reversed, but it can be slowed down. certain aspects of aging can be mitigated or slowed in terms of their decline. But aging is not something that we stop or we go up the other way. Sometimes improvements can feel like that, but really our brains are all declining at a specific rate, okay? There's a normal rate, and then there's an abnormal rate. And most people are either in the worried well category. I would assume that's most of us here. We're healthy, we're generally healthy. I don't want to make any assumptions. If we have people with diagnosed cognitive impairment in this group, power to you, welcome. And if we have the worried well category, that's people who are healthy that are worried about preventing cognitive decline. I'm gonna say that's 80% of the people you're gonna work with are probably in that category. There's also the subjective phase of cognitive impairment. Here it's called the preclinical phase on this slide. In the subjective phase of cognitive impairment is that you or your client has noticed a change in their cognition, their attention, their memory, their organizational skills, their processing speed. However, they haven't gone to a doctor, and other people may not really notice, but they notice. Then, and you can see on the light blue line here, that's where we might be if we're in the subjective cognitive phase. And subjective cognitive changes in the brain might precede a diagnosable cognitive condition, even 10 or 20 or even 30 years prior to an actual formal diagnosis of a cognitive impairment. Then we have MCI, which stands for mild cognitive impairment. This is a diagnosable condition and one or more domains of cognition are impacted more significantly. And this is where the family might start to be concerned. Sometimes there's some denial about that, or there's some ignorance. We think it's part of normal aging, or there's a lot of anxiety where they think it's dementia. It's actually somewhere in between. It is a mid-stage. It's a mild stage of cognitive impairment. But if we do nothing about it, or if we continue on this trajectory, we do have a risk of converting to dementia, which is defined as cognitive impairment severe enough to interfere with everyday abilities. And there's different stages of severity. There's also different types. Alzheimer's disease, once again, is one type of dementia. We also have vascular dementia, Lewy body dementia, frontotemporal dementia, mixed dementia, pseudo-dementia. There's a lot of different types. And so our goal is to prevent dementia. Our goal is also to prevent MCI. And I would also say that there's probably a good chunk of your clients or people in your community that maybe have undiagnosed cognitive impairment. Unfortunately, it's not common for people just to go to a neurologist for a brain checkup. People will get a physical, people might get a colonoscopy, but they won't go check out their brain. And this is a big problem. Early detection of cognitive decline alone could save the healthcare industry in the United States trillions of dollars. So one of the best things we can do is educate our community and our clientele about brain health and be able to encourage them to go seek out some sort of memory evaluation from their doctor or specialist, such as a neurologist. That alone, even if you don't change anything about what you do, encouraging people to go assess their brain health just to be preventative or to diagnose perhaps what might be a probable cognitive impairment would be a huge lift to the burden of cognitive decline on the healthcare industry and to families. And ideally, we're slowing this curve as much as possible. It would be great to identify that individuals are at that light blue line and bring them up to the green line. Now, how do we do this? How do we actually make improvement? Well, for us to make improvement, we have to get the brain to change, either structurally and or functionally in the brain. And so what we can do is target a process called neuroplasticity. And it's not really targeting neuroplasticity. Neuroplasticity isn't something that you really do or have a goal of. Neuroplasticity is a mechanism by which the brain is able to change. It's almost as if we can grow muscles to be bigger or stronger, okay, or more powerful, that could be called bioplasticity. I don't think that's an actual term, but we know there's an ability for the muscular system to change, either in size, that would be structure, or in how the neuromuscular unit works, that would be function. The same goes for the brain. The brain is not something that's non-plastic, that's not moldable. It is moldable. It is plastic. This is called neuroplasticity. However, as we age, the way the brain responds to these experiences is going to be altered. It doesn't go away, but typically the effort required to elicit neuroplastic change is greater. But what happens with age? Retirement. We stop having that regular cognitive stimulation. Unfortunately, sedentary behavior. Many older adults are mostly sedentary or not meeting the minimum requirements for physical activity. However, for us as fitness professionals and health professionals, it behooves us to be able to incorporate more cognitive and more physical demands so that these individuals can achieve their goals through the process of neuroplasticity. So what goes into brain health? If we're going to modify this trajectory, and we're motivated to do that, what can we actually do about it? Well, there's actually a lot we can do about it. And the degree at which each of these things makes the change is dependent upon the individual, their age, their biology, and what is actually done. But there's modifiable health factors in the upper left-hand corner, and that represents everything within the lifestyle domain. Exercise, which is what we're talking about today, sleep, nutrition, stress management, and other things like blood pressure management, medication management, things that seem very simple, but are extremely impactful for brain health. Level of education also seems to matter, but not as much as we used to think. There's more and more research coming out that just having a higher level of education does not stop you from getting dementia. In fact, many of the patients I work with are medical doctors and PhDs that now have mild cognitive impairment or dementia. So it does not guarantee, just because you have a higher level of education, that you will not get some sort of condition. Lifestyle seems to be one of the primary things that modifies this disease trajectory or this cognitive trajectory. Something that we probably all appreciate, especially during quarantine and as we start to open up again, is social support. We probably didn't recognize how important social support was for our brains and our minds until we lost it. Same thing with our clients. We see many patients here at the Pacific Brain Health Center whose cognitive decline has worsened or they developed cognitive decline due to quarantine, mostly because of lack of social support, stress, poor mood states, sedentary behavior. There's a lot of different variables there. I don't think any of us are excluded from that. You probably have felt your mental health and cognitive health affected by the pandemic for a variety of reasons. I don't want to assume, but that seems to be a lot of people that I talk to, including myself. Positive affect seems to be very important for brain health. Maintain positive mood states. Of course, if there is a mental illness such as depression and anxiety, managing that is important for brain health. Neuroticism gone unmanaged is not good for brain health. So it's important to make sure to work with behavioral health providers to manage that and just do things that contribute to positive mood states. Stimulating activities and novel experiences also seem to be very important for brain health. This might be why, or one of the reasons why education is important for brain health, because within education, we have social support, people with shared ideas. We are challenged to learn new things. And so that might share one of the mechanisms as to why education is important for cognitive reserve. But novel activities and stimulating experiences are extremely important, as is cognitive demands. Cognitively stimulating your brain, and there's a lot of ways to do that. Now, what is cognitive reserve? It's essentially your brain's gas tank. And the higher or the more full this gas tank, the longer your trajectory goes for, and the more robust that trajectory is. Now, let me pose something to you. I'm going to spoil the surprise that exercise is one of the, if not the most powerful things we can do for our brains. In fact, if you go on the World Health Organization's website, I know this past year has been an attack on science, but the World Health Organization is very good at collecting evidence and presenting it to the general public as it relates to public health issues, including cognitive decline. And so if you look at their report, exercise is at the top of their list for having the strongest recommendation and evidence basis for slowing cognitive decline. So recognizing that exercise is one of the most powerful things we can do to contribute to cognitive reserve, and we'll talk about why, what the mechanisms are in a second. Some people have called this a polypill. Exercise is a polypill. You've definitely heard exercise as medicine, but exercise is also a polypill because it does so many different things and acts on different mechanisms. So if exercise is a polypill and it's good for the brain, we could also call it a neuropolypill. I know that's a bit of a mouthful, a neuropolypill. Polypill referring to many different mechanisms, neuro referring to the brain. So if we were to make this pill more potent, lots of alliteration going on, then we want to add in as many ingredients that we think are going to make that exercise prescription, that medication of exercise, more potent. So it's not just about exercise. What if our exercise included positive mood states and we program not just for sets and reps, but to feel good? Sometimes this is implicit. We just feel better after exercise. We'll talk about why. But also, we don't really think about programming for the sake of positive mood states. We might be thinking of programming for weight loss, programming for corrective exercise, and we're very focused as experts as to what it takes. But how often do we think about what individuals enjoy? Then programming for social support. I'm not saying group exercise is the most important thing, but it is something that's extremely unique and valuable about setting a community around exercise. Often, the social support is the rapport between you and a client in a one-on-one setting. But same thing for a small group where there's larger communities. And just knowing that other people are doing what you're also doing for maybe similar reasons is also social support. But what if your exercise programs also included stimulating activities, novel experiences? It's far too often we have this ideal of an exercise program, and then that exercise program stays the same. I talked to so many patients who said, oh, I used to work with a trainer or a physical therapist, or I still do, and that the routine is a routine that is fixed and does not change. This is a huge problem. One, for physical reasons and physiological reasons, we need to engage in progressive overload and variability. But two, the brain needs stimulating activities and novel experiences. So I have patients here that I'll work with that have had the same routine for 5 years. I hear a lot, oh, I got rid of the trainer because I learned the exercises and I can do them on my own. Well, that program was not the secret. The secret was keeping things progressive and overloading for you, as well as stimulating and novel. And a lot of those individuals experience cognitive decline. And I'm not saying it's because they didn't update their exercise program, but you can tell that it's lacking those characteristics. And we have to think, if we did update our exercise programs to be stimulating and novel, how might that affect the brain differently? And then finally, but certainly not least, cognitive demands. This says cognitive training. I'm not referring to brain games. I'm actually referring to cognitive demands. And there's different types of physical activities that have cognitive demands. And part of the issue with that routine approach is that it becomes learned, the brain becomes extremely efficient, and now there's no cognitive load. It's not cognitively demanding. You can almost do these things automatically. And so by bringing in novel experiences, positive affects, social support, stimulating activities, novel experiences, we could probably agree that would make exercise a more potent neuropoly pill than just getting your heart rate up on a bike. Could we all agree? Raise your hand if you agree with that. Let me know in the chat if you agree with that. You can say amen, right on, Ryan, et cetera, et cetera. So the higher our cognitive reserve, the longer we offset neuropathologies such as dementia and other types of neurological conditions and cognitive decline. So we want to increase this gas tank. And once again, there's the cheap gas and there's the expensive gas that lasts a lot longer and is better for your engine. That's where I'm going with this combination approach. So let's talk about aging. Let's talk about how aging occurs in the brain. This is going to be an example of how aging occurs. We're going to talk about this area of the brain called the hippocampus. And the hippocampus is just one area of the brain that is talked about a lot in the aging literature. It's talked about a lot in neurology clinics when people get a volumetric MRI of their brain. And it's usually referenced in exercise literature. So its decline in structure or function is related to age-related or dementia-related memory issues. So individuals who are experiencing memory loss and they have trouble with names and faces and navigation and other types of memories, it's typically related to a change or a decrease in the structure and or function of this area. It's also associated with verbal memory because the temporal lobes are right beneath the ears. The hippocampus is deep in the temporal lobes. And there seems to be an interesting relationship with the lower extremities as well. So there is this interesting, I'd love to show you a Venn diagram of this, but you can imagine gait or walking, balance, and cognition are all intimately related in the aging process. And it's also one of the areas where neurogenesis, or the creation of new brain cells, is likely. And the hippocampus seems to be very sensitive to lifestyle interventions. When we are sedentary, when we are stressed, when we don't sleep well, when we don't eat well, there seems to be a negative impact on the hippocampus. But the opposite is true. When we exercise, when we sleep well, when we manage stress, when we eat well, the hippocampus seems to be more robust. However, the neurogenesis hypothesis the fact that the idea that we're creating new brain cells in the adult human brain is still being debated. But don't lose hope, because there's still ways for our brains to change, even if the mechanism isn't creating new brain cells. Okay, so let's go back to the concept of aging here. So there's different ways that the aging process can occur. Let's continue to talk about the hippocampus as an example. We might experience more neuroinflammation in the brain, looking on the left-hand side here. That would reduce the support that's given to the cells. It could cause oxidative damage to the mitochondria. It could create cellular senescence, in which the cycle of life is sort of broken a little bit, and it can lead to protein aggregation. An example being amyloid plaques, which is one of the diagnostic hallmarks of Alzheimer's disease, as indicated by PET scans. There can also be Lewy body. Lewy bodies are also a type of plaque. There's tau tangles. There's different types of aggregates of these proteins that can disrupt the function and structure of neurons and neural circuits in the brain. That can lead to a downregulation in neurogenesis, synaptic plasticity, which synapses are the bridges between the neurons. The dendrites don't function as well, and the neurons, we actually lose neurons. Because of one or more of these mechanisms, we might actually experience a downregulation in hippocampal atrophy, that being the hippocampus actually shrinking as indicated by a volumetric MRI. That could lead to cognitive impairment, and that could lead to neuropathologies like dementia. But at every level, from the micro level with neuroinflammation to the even larger level of brain cells to the even largest level of actually a brain structure like the hippocampus, we can do something about it. And you may be thinking, well, when is it too late? And it depends. But typically, if we're looking at the MCI, the subjective cognitive impairment, the worried well, the earlier stages, there's more we can do about this than the later stages. So the earlier that we start, the better. And so once again, all of those things that go into cognitive reserve, dietary interventions, physical activity, cognitive stimulation, stress management, all of that, or at least one or more of those things, ideally in combination, can offset some of these negative mechanisms. So there's different types of neuroplasticity. There is structural neuroplasticity. This is defined as neurogenesis, or the creation of new brain cells. Structural neuroplasticity could also be the change in brain volume. But then what's more likely in the adult human brain is not just the creation of new brain cells, but the change in how they function. Just like we may not create new muscles, we might just change how they work and the robustness of that muscle. I think it's more similar to, the brain is more similar to that than just creating new brain cells all of the time, and that therefore being responsible for these improvements. Once again, this is a very heavy debate in neuroscience right now, and it continues on. It's been shown in animals, it just has not been shown in humans yet. So functional neuroplasticity includes synaptic changes. Synapses are the bridges between brain cells, and new skills and experiences create new connections in these synapses. And these are either strengthened with use or weakened with misuse or non-use. And so this is related to Hebbian plasticity, where that use it or lose it hypothesis comes from. There's some weakness to that model as well. And there's also weakness to the neurons that wire together, fire together model as well. Just because I'm brushing my teeth while on a skateboard doesn't mean the skateboard neuron and the brushing the teeth neuron all of a sudden wire together and strengthen. That's not exactly how it works. But we do know that the brain in its structure and function is responsive to change, and these are some of the mechanisms. Now, how long does this actually take? Well, it does depend on what the goal is, but for example, the synapses that send neurotransmitters to and fro can actually be modified in milliseconds. Does that mean it's a significant change to your brain within milliseconds? No. But it does mean that our brain activity can be modified in a very short amount of time. Then we have the branching of synapses and dendrites, these structures on the neuron that can branch and grow, and that can take several hours. New brain cells can be produced in as little as several days. The networks of these brain cells and the morphing and the changing, the improvement of these networks can take several weeks and months. And changes in brain volume, this is the goal, changes in brain volume, this is going to be more meaningful for us, takes several months and years. So brain health is a long-term game. It's a long-term goal because of this. Now, to summarize a little bit, and this is not meant to be fat phobic, I'm very body positive, so please don't let this picture they come across as if I'm fat phobic here. But the normal adult human brain is supposed to be healthy. And once again, we experience changes in the human brain that are normal. With accelerated factors like poor lifestyle, one or more of these areas mentioned in cognitive reserve, we can experience cognitive decline. Genetics, of course, also play a role, but as you've heard, genetics load the gun, but lifestyle pulls the trigger. Adaptive factors like healthy lifestyle, diet, and exercise, for instance, can contribute to healthy aging. And depending on the amount of cognitive impairment and the type of cognitive impairment, therapeutic factors such as the same lifestyle things we're discussing can offset some of the cognitive decline if it's being experienced. So it really never is too late. And even if we cannot reverse something like dementia, even if we can't stop it, at least we can try to slow it down. And even if we can't improve cognition significantly in an individual that does have dementia, depending on the stage and the type, at least we can improve quality of life. So in that sense, there's always something we can do, always. It doesn't mean we can, miraculously reverse all of these conditions negatively affecting millions of people, but we can prevent it and we can improve the condition. To how much and what degree it depends. So let's talk about the general physical activity guidelines for American second edition. And the reason I'm bringing this up, you've probably heard of this before. The reason I'm bringing this up is because we often need to know how much exercise, what is the dose response in order to glean the benefits of brain health or that associated with brain health. Well, you've probably heard this before. For substantial health benefits, adults should do at least 150 minutes to 300 minutes a week of moderate to vigorous intensity aerobic exercise or equivalent. And that is 2.5 hours to 5 hours in English. And that could be 5 days a week of 30 minutes, 3 days a week of 45 to 60 minutes. There's a lot of different configurations. And also for higher intensities, 75 minutes also seems to be equivalent. However, if we just did this, is this enough for brain health? I want you to think about it. Tell me in the chat if you think hitting at 150 minutes of moderate to vigorous aerobic exercise is enough for brain health, or do we need more? I want to hear your thoughts. Okay, so I'm seeing a lot of no's, and I'd say you're correct and incorrect at the same time. When we say more, do we mean more intensity, more minutes, or more different types of activity? Okay, so just to work on our critical thinking here, you're all correct in one way or another. It's okay, more variety, more different types. That's exactly where we're going. And so what's important for us to understand is that if they do hit those 150 minutes, research has found they will get significant brain health benefits. The question is, can we get more out of it? And so there's more frequency, there's more duration, there's more intensity, there's more variety, and then there's novelty within the modalities that we're participating in. All of these seem to be considerably important ingredients for our brain health. So let's explore what the research is saying. There are additional benefits for more minutes, so you're all correct there. So we could theorize that if you got 300 minutes, you're going to do better for your brain than if you did 150. But all the people saying variety and different types, you're also correct. There's additional benefits for strength training 2 to 3 times a week. And there's additional benefits for what's called neuromotor training. Nobody talks about the neuromotor category. When we think of exercise, we just think of aerobic, we just think of strength. But neuromotor is a very special and important category when it comes to brain health, because the neuro represents the brain, the motor represents the body, and it includes a lot of different types of activities that we're going to define. So there's additional benefits for partaking in these modalities as well as more minutes. And research says that multi-domain exercise programs slow the progression of cognitive decline more than single and shorter modality programs. So already just doing more than one thing is going to prevent dementia better than just doing one thing. So you're all correct there. And it seems to be that while we can understand that 150 to 300 minutes per week is the minimum, there also was this very interesting systematic review done by Dr. Joyce Gomez Osmond and her team a couple years ago, 2 or 3 years ago, that looked at over 10,000 research participants across about I think 70 something studies, and found that regardless of the physical activity, didn't matter if it was walking, Tai Chi, aerobic exercise, resistance training, it took 52 hours of exercise for older adults with cognitive impairment, including MCI and dementia, and without, to gain significant benefits in cognition, specifically executive functioning and processing speed. Executive functioning is an umbrella category for a lot of different types of cognitive functions like organizing, short-term memory, impulse control, things of that regard. So it took 52 hours of exercise to get those significant benefits. That's what contributed to these significant improvements in cognition. Therefore, that's the minimum dose response to achieve it. However, 52 hours over what period of time? And listen closely, it didn't matter. It could be 3, 6, 9, or 12 months. Everyone's going to have their frequency and duration preferences and abilities. And so just to give clients an expectation of the minimum requirements for brain health, you should have a minimum of 150, and you should do that until you hit 52 hours. And at that point, you should expect some sort of significant cognitive benefits. That doesn't mean we stop after we gain them. We ideally keep going and modifying our programs as such. So some people are asking in the chat, should I be standing on the elliptical watching the news? And as long as that exercise is 150 minutes at a moderate to vigorous intensity, typically when people are watching the news or they're distracted, ironically, because we're going to talk about the benefits of combining cognitive and physical tasks, that they're typically at a lower intensity. And I like to use an RPE scale, rate of perceived exertion, 10 being the most intense, 1 being the least. A 6 to 8 out of 10 is what we're looking for. So if you're being on the elliptical watching the news is a 4, as it is for many people, then you need to get that up a little bit. But yes, even if it doesn't matter how we achieve that 150 minutes, as long as it's at a moderate to vigorous intensity, as long as it's getting your heart rate up above resting levels, it doesn't seem to matter how we get there. But then on the other hand, I'm saying it does matter because there is emerging research showing that variability, the modalities seem to be important, and we're going to learn why. So let's talk about and briefly summarize the whole spectrum of how exercise can affect the brain. Because typically when we hear about this, and I'm sure you already have, we're usually hearing, about exercise is good for blood flow and that's why it's good for the brain, or it's good for brain-derived neurotrophic factor, which is Miracle-Gro, and that's why it's beneficial. And there's truth to all of these claims, but the degree in which those are valuable for the brain have yet to be found. And it really does depend. Instead of being mechanistically focused, saying, it's all about blood flow, it's all about brain-derived neurotrophic factor, it's all about just experiencing improvements in memory, it's actually all about all of these things. And so the reality of how exercise affects the brain is that it affects it at different levels. And earlier in the presentation, I talked about how exercise is a neuropolypill. Polypill meaning a lot of different mechanisms, and that's still very true for the brain. So there's 3 different levels. The micro level is the hormones, the growth factors, the neurons, the synapses, the blood flow at the level that you can't see, but that's been studied in rats or animals, or it's been studied in humans with certain types of imaging or getting blood markers, for instance. At the macro level, that's increases in brain volume. An example would be increasing the size of the hippocampus as the result of 6 months of aerobic exercise, or increase in function, i.e. participating in a ping pong intervention for 12 weeks and experiencing more efficient brain activity. So the macro level is improving the brain functionally and or structurally. And then the stuff that we ultimately see and feel is the behavioral level. Improvements in cognition, such as attention, memory, and processing speed, and or mood. I feel better. And then the research is starting to show that as we exercise and we increase the amount of exercise we get, we start to feel better, and that increases the chances that we're going to exercise more, because exercise is a behavior, and if it wasn't a problem, everybody would be doing it, but behavior change is still a consideration. So the micro, macro, and behavioral level are the 3 ways in which exercise should affect the brain, or can affect the brain. So let's talk about the acute effects or the short-term effects of exercise in the brain. We're often thinking how exercise affects the brain in the moment it's happening. Most of the time I'm talking about repeated stimulation over time, say 3 to 6 months, for instance, leading to significant improvements in cognition or brain morphology or size. But let's talk about what happens after one session of exercise. And certainly, this review is very broad. So certainly it's a broad sort of category, because you're probably asking what kind of exercise. This review reviewed exercise that lasted anywhere from 5 to 90 minutes of low to high intensity. So this is sort of general across most exercise modalities, but depending on the type and the intensity and the duration, there's probably some slight individual differences there. But for up to 15 minutes after stopping exercise, you have this increase in prefrontal activation. And we're going to come back to why that's important. For up to 30 minutes, you have increases in these excitatory brain waves, delta, theta, alpha, beta. They all excite because exercise is an excitatory activity. We also, for up to 30 to 60 minutes, we have the increased expression of these neurotransmitters like lactate, GABA, glutamate, norepinephrine. For up to 2 hours, we have increase in the expression of dopamine, cortisol, serotonin, and also this brain-derived neurotrophic factor, which we're going to talk about more, which has been called Miracle-Gro for the brain by Dr. John Rady, who wrote the seminal book, Spark. For up to 2 hours, there's also improvements in prefrontal cortex-dependent cognitive functions. We talked about that prefrontal cortex activation. So for up to 2 hours, you have this improvement in functions in your prefrontal cortex so that you can organize better, short-term memory, pay better attention, things of that regard. For up to 3 hours, you have stress reduction. And for up to 24 hours, you have improved mood. And then those things go away after 24 hours until you do them again, and until you do them again, and until you do them again. And over a period of repeated days and weeks and months, these improvements, such as cognition, the more efficient utility and release of these neurotransmitters, the presence of these growth factors like BDNF, certain brain regions improving in function and or structure, mood, they start to be more significant and they start to be more longer lasting. So let's quickly talk about some of these growth factors. These growth factors are very confusing to understand, but they're molecules, hormones, and proteins that get expressed as a result of most types of exercise that contribute to brain health. In the middle of this graphic, you're going to see what's called a neurovascular unit. A neurovascular unit is one neuron, one brain cell, and the blood vessel that feeds it oxygen and nutrients to survive and thrive. And so one of the things that happens is lactate, looking on the lower right-hand corner, lactate is expressed from the muscles, goes through the bloodstream, crosses the blood-brain barrier, or the BBB, and tells the brain to do good things, specifically facilitating the release and expression of BDNF, or that brain-derived neurotrophic factor that has been called Miracle-Gro for the brain and contributes to protecting the neuron, to growing new neurons, or to increasing synaptogenesis, proliferating the new connections between neurons. There's also nerve growth factor, or NGF, that also contributes to the growth, maintenance, and proliferation of neurons. There's vascular endothelial growth factor, or VEGF, that contributes to angiogenesis, the creation of new blood vessels, and neurogenesis, the creation of new neurons, we think. And then IGF-1, insulin-like growth factor, whereas VEGF is very much released with aerobic stimulus. IGF-1 seems to be more released with aerobic exercise or resistance training. So IGF-1 and another growth factor called irisin, which is named after Iris, the messenger to the gods in Greek mythology. IGF-1 and irisin seem to be more released with resistance training and contribute to cell survival, neurogenesis, and neuroprotection. So different types of growth factors do shared in different things, and we want a buffet effect. We want as many different ones and as high concentrations of these as possible, which is the impetus for the variability approach, doing different types of exercise. Here's a picture of angiogenesis. It can start at the micro level, little capillaries feeding the neurons, to a larger network level, feeding larger areas of the brain. Angiogenesis is the formation of new blood vessels and can even occur in adulthood and is correlated with neurogenesis. Because theoretically, if we can feed neurons and brain cells with more blood flow, with oxygen, with nutrients, they're more likely to grow and thrive. So as we exercise, we increase cerebral blood flow, which contributes to healthy angiogenesis. that can lead to increased capillary density. It's more responsive to metabolic demands. It's a better connection. Then we think, as we showed earlier, that can contribute to the structure, function, and robustness of the neurovascular unit. Okay, complicated slide warning. This is not to scare you. This is to give you a full appreciation of the complexities and the timelines in which exercise can affect the brain positively in the short term and the long term. Okay, let me get my annotation tools out. This is going to be a fun ride. So we have physical activity. Metabolically, it increases mechanical stress on blood vessel walls. In the short term, there's transient elevation, meaning short-term elevations in the permeability of the blood-brain barrier, the barrier of vessels from the brain that differentiates it from other aspects of the body. Increases BDNF, increases VEGF, increases IGF-1. It also increases the expression of vascular endothelial growth factor in the hippocampus. Then what happens is, over a longer period of time, cardiovascular fitness improves. Usually the best indicator for this is VO2 max. We don't use this a lot in our clinical setting, in our fitness settings, but there's ways of predicting VO2 max in cardiovascular fitness. That takes about 3 to 12 months to improve. We also have improvements in angiogenesis that can go from 10 days to 3 months, in reductions in central nervous system inflammation or neuroinflammation. This is the topic of my master's thesis. That can change in 6 to 10 months. These things aren't rules. Certainly you can experience reductions in inflammation immediately, but over longer periods of time will create more significant effects. Increased cerebral circulation, serum VEGF increases in 0 to 4 weeks, cerebral blood flow 3 months, signaling the growth factors 3 to 4 weeks, hippocampal BDNF from 0 to 8 months, CREB activation 2 to 8 weeks, neurogenesis 0 to 8 months, hippocampal growth factors 8 weeks, the preservation of the gray and white matter in the brain. This is specifically on the macro level. There's 2 tissue types in the brain: myelinated or fat-wrapped neurons, white matter, and unmyelinated neurons, gray matter, that's sort of more making out the cortex and the outside of the brain. That takes up to 6 months. And we have more cognitive demands that can enhance the structural and functional changes of the neurons that are created, we think, and lead to better cognitive benefits. There's a lot going on. All we need to know is that there's a lot of beneficial stuff happening at the micro, macro, and behavioral level. And ideally, we're aiming for a minimum of 3 to 6 months of exercise. 6 months probably being the most common to get the most benefits. Let's not forget the effects of exercise on mental health. We know it can lead to increased energy, improved confidence, increased self-esteem, improved sleep, improved mood, as well as reduced stress. And there's also more and more research coming out showing the positive benefits of exercise in depression, anxiety, and a myriad of other mental health conditions. Okay, so now let's talk about how exercise affects different brain regions and why we might want a variety instead of just one type of exercise. So the hippocampus we've talked a lot about is located in the temporal lobes right underneath your ears. And with aerobic exercise, it's also been found to increase in structure and volume. Most of the research that you're going to hear about as it relates to exercise in the brain says that aerobic exercise is the best form of exercise for your brain. Yes, because it's been shown, but no, it's not the best. Anytime we say anything is the best, run the opposite way. That person or that source isn't considering the whole picture. We know that the hippocampus responds very well to aerobic exercise, but it also responds to resistance training and just increased physical activity in general. So filtering out the effect is interesting. And there's also different parts of the hippocampus. So we know that aerobic exercise is important for the temporal lobes and the hippocampus, but resistance training has also been found to affect this area. And as we increase the size and structure of this area, that's been found to lead or at least be related to improvements in memory. But what about the frontal lobes? On the front of the brain, there you have your frontal lobes that houses those executive functions. And there's a systematic review showing that resistance training seems to emphasize structural and functional improvements in the frontal lobe, leads to lower white matter atrophy and lesions, and it includes improvements in executive functions, the CEO of your brain. Now, aerobic exercise has also been found to affect the frontal lobe positively. So these effects are not exclusive, but the volume of the effect is turned up a little bit in these regions. Then we have the cerebellum, and deeper in the brain, the basal ganglia. And neuromotor fitness or motor fitness seems to improve cerebellar and basal ganglia size and structure. So what are examples of motor fitness? We'll get to that in a second. But the crux of these activities, like sports, dance, and martial arts, and mind-body exercise, is that they're skill-based activities. And that research is starting to show that because we're developing the skill sets, because there's simultaneous cognitive demands of learning, that seems to mediate or lead to these cognitive improvements. So once again, sports, dance, martial arts, that includes the mind-body activities like Tai Chi, Qigong, yoga, Pilates, and it could be anything from ping pong to Tai Chi to Zumba that's going to be in this category of neuromotor fitness. But it also includes cognitive motor dual tasking, which is another presentation that I give, cognified fitness or boosting the brain with cognitive tasks. The crux of that content is dual tasking, doing a motor and a physical task at the same time. However, a lot of these activities that I'm talking about, sports, dance, martial arts, and mind-body exercise, naturally incorporate dual tasks, as we're going to see. So let's differentiate between these different types of activities. We have aerobic training and we have strength training, and we know what those are, and those contribute to physical training. That's the domain that we're talking about, is physical training. And the crux of how these actually contribute to brain health is mostly through metabolic demands, increasing blood flow, releasing growth factors from the muscle, things of that regard. Now, we also have on the right-hand side, we have motor training. So flexibility, balance, coordination, all of these things are motor demands, and they improve the brain via neuromuscular demands. So while the way physical training improves the brain is through intensity, the way neuromuscular demands or motor training improves the brain is through task-specific cognitive demands. So the more metabolic side might feed the neurogenesis, the more neuromuscular side might feed the synaptic plasticity. That's some of the working theory. But there's also activities that combine both, such as tennis or ping pong. These are skills that can get your heart rate up, as well as incorporating task-specific learning. But then there's dual tasks. And while this says counting backwards while walking, I do not recommend that activity. It's just a very layman example. It is not the type of activity I recommend in order to do dual tasks. That's covered in a different presentation and in my course. But dual tasking is a way to represent simultaneous metabolic and neuromuscular demands. Okay. So an example is ping pong, and you may be thinking, ping pong, why would I do ping pong? Well, ping pong enhances mental acuity, improves reflexes, increases your heart rate. It tends to be a little bit easier on the joints and encourages social bonding. It's also very intergenerational. I highly recommend ping pong as an intervention in the neuromotor category. Ping pong is really interesting because a lot of people already have a table. I find about 40 to 60% of the patients I talk to, I mention the benefits of ping pong as an example of neuromotor training. Like they say, oh, I have a table. I'm like, use it. Just like when I educate people on the benefits of aerobic exercise on the brain, they say, oh, I have a bike. I hang my clothes on it. I say, use it. And then also I mention the benefits of dance on the brain or yoga. They say, oh, I haven't done that in so long. I used to enjoy that. Well, relating their goals back to these activities they enjoy or already have access to is a great way to modify behavior change. Now, anytime we're going to learn a new skill, there's these different phases of motor learning. This is called the different phases of motor learning put forward by Fitz and Posner, I believe the 1980s. And the cognitive stage of motor learning is what we're targeting. Learning new skills and experiences is going to put us in this stage where things are most cognitively demanding. Unfortunately, they're also more awkward and they're a little bit more frustrating until we get to the associative stage and we start to smooth out those skills, and then the autonomous stage where it's almost automatic. My issue with what I mentioned earlier, with these types of routines, these exercise routines, contributing to or being the primary focus of individuals, is that those routines are the same. And now they've become autonomous. And now they've lost their cognitive demands. And so we think one of the reasons that novelty is helpful is because every time you introduce something new, you have to learn it. And when you're learning it, you're in this cognitive phase of motor learning. So it's helpful to know for certain exercise programs or techniques for you or your clients, where do you think you're at? Is it time to introduce something more novel or more challenging and go back to that cognitive stage of motor learning? In addition, the reason we want to incorporate cognitive demands is because as we evolved, we likely needed to use brain and body at the same time. And so this is called the adaptive capacity model that was put forward by Dr. David Reichland and Dr. Gene Alexander. About 6 months ago, they wrote an amazing article that was shown in Scientific American all about this model. And while we were hunting, we needed to use our brain, our cognitive demands, our sensory demands, our motor control demands, and our body at different speeds at the same time. So instead of just barefoot running or eating more protein or more plants, whatever that thought process is as to why our brains grew, this model seems to think that because we were moving and thinking at the same time, demand and supply and demand, the brain needed to grow as the body needed to grow. And so this is a very interesting model to look at as to maybe we shouldn't be separating brain and body within what we do. So this is a more complicated slide. I'm not going to ask you to memorize this slide. What's important to know about this is that there's different types of activities, and different types of activities contribute to different adaptations in brain regions. I've written an article about this that I think will be on the ACE website very soon. I can also send it to you if you're interested in reading more about this, how we take a brain region approach to exercise programming. And this is explored more in depth in my course and in other webinars that I've done, where we break down each area or region of the brain and how research has shown that different types of activities might turn the volume knob up on emphasizing that certain region. So all we need to know is that different types of activities might target certain regions. Just we talked about the frontal lobe, the hippocampus. It's very much following that line of thinking. This is a summary. Since you have a PDF, you can study this, hang it on your bedroom wall, hang it on your fridge. And of course, you'll learn more about it in the course. But this is to develop an appreciation for how different types of stimuli and activities may contribute to different regions of the brain. So let's apply this. We have 3 primary modalities of exercise. We have aerobic training, we have resistance training, and we have motor and skill training. Aerobic training, we know there's steady state and interval. For strength, we know there's closed skill like machines or open skill like functional training. And for motor and skill training, we know there's sports, dance, and martial arts. And we know there's the mind-body category like yoga, tai chi, Pilates, and qigong. So let's give an example program in which gut reaction, you're probably thinking this is not enough for an individual to sustain significant brain health benefits. However, if you look closely at this sample exercise program, you will find that it meets the 150 minutes and has all 3 modalities: aerobic, resistance, and neuromotor. And so we have bike and weights on Monday and Friday, 30 minutes each, 60 minutes total, 6 to 8 out of 10 on intensity. Dance on Wednesday, we're doing Zumba, 60 minutes, let's say 5 to 7 or 4 to 7 out of 10. The reason I say 4 to 7 is because as you're learning something new, it's a little bit slower, a little bit more awkward. As you become more proficient, you can get a little bit more of a metabolic demand in there. And then let's say we do walking, and that could be a brisk walk. It could be a leisurely walk on Saturday. Once again, the initial gut reaction from us as fitness professionals is this is not enough. But if we're working with a 68-year-old that has been sedentary their entire life and their goal is to prevent dementia, and they can only give us 3 days a week, and this is what we have to work with, and this is what they agree they can do, and we're going by the principles of behavior change, they're still meeting the minimum requirements here. We're both winning. We're in partnership with that client to help them get to eventually what might be a more robust program of greater minutes, intensity, frequency, or variety. And certainly if you wanted to have an exercise and physical activity program for an individual that's more dedicated, or an EPAP as we call it, and let's say they want to improve their attention, whereby a program for memory might look a bit different, and we cover how we design a program for different cognitive goals like memory or attention in my course. It's important to say, all right, this individual is motivated. I'm going to meet them where they're at. They're dedicated to exercising every day. So I'm going to try to create a very multimodal program for this individual. So Monday, Wednesday, and Friday, we have a multi-component program of AT or aerobic training, resistance training or RT, and balance training. We could up-regulate and down-regulate the minutes or emphasis on those. Let's say 20 minutes per type, 60 minutes total, moderate to high intensity. We can do Tai Chi Tuesday and Saturday, and we could do dance Thursday and Sunday. We can replace Tai Chi with yoga. We can replace dance with ping pong or tennis. There's really no rules to this, but you can see there are at least, I believe, over 320 minutes. They're at least at a moderate to vigorous intensity. They have the aerobic and resistance. They could do more of the resistance here probably in this program. They could also increase the intensity or number of minutes in any of these domains, but you can see how we're checking off all the boxes. We got the skill base that's more metabolic. We have the skill base that's more mind-body. We're getting everything in here. So what are the acute variables we need to be aware of? You're probably familiar with them: frequency, duration, intensity, but also the softer acute variables, as I'll call them. Skill. Is there a skill demand? What skill are you teaching? Are you a rep counter or are you a skill teacher? And that's a big change we need to make in the fitness industry, is teaching skills, not counting reps while sitting down on a Bosu ball, texting our best friend. Novelty. How novel and cognitively demanding is this exercise program? We do RPE, scale of 1 to 10, how physically intense. How cognitively intense is the exercise program? 10 being the most cognitively demanding, 1 being the least. You can use that scale to determine, is the technique cognitively demanding? Now, it shouldn't always be a 10, and that's probably too frustrating, but should at least be a 6 to 8 out of 10 for your cognitive demands within certain exercise techniques and or within the program as a whole. And then environment. Is the environment constructive of positive mood states and or having social interactions such as found in community, and even just having a good relationship with them? I mean, I'm just so disappointed to find that so many patients and clients I'll work with have codependent relationships with their personal trainers, where their trainer is taking advantage of them. They've been doing the same routine for 5 to 10 years. That's not a healthy relationship. So just having a healthy one-on-one relationship is really important, but also facilitating community interaction, whether it's just encouraging them to exercise with their family, dancing, playing ping pong, going for walks, coming to an exercise class, being around people like them. There's a lot of ways to foster community. And let's not forget all those other lifestyle factors that influence brain health and cognition. Exercise and physical activity we've talked about to exhaustion today. Sleep, diet, stress, medication management, comorbidity management, cognitive stimulation, and social support. All of these are important to consider. And this is why it's not just important to educate yourself on the exercise piece, but health coaching, medical fitness, multidisciplinary care for individuals can help us address most of these if you do it the right way. So how can you start a brain health program within your business? Well, the first thing is continued education. You're doing that by being here today. I'm going to show you how to do that in a more involved way if brain health is something you're more interested in. You want to partner with allied health and or medical individuals, whether that's sleep medicine, neurology, neuropsychology, psychiatry, nurse practitioners, whatever it may be. Selecting products, tools, and or technologies that can help you with your business, whether that's a brain body training tool like a SmartFit or a virtual reality headset or a cognitive assessment tool or a health coaching tool, whatever it might be. You want to identify the services you're providing, or you're just incorporating more brain-based exercises into your program. Are you now, from this presentation, and maybe you take my course, and then you're now creating exercise programs at a macro level for people to prevent cognitive decline and then referring to neurologists to build your business? Are you doing health coaching and making it brain health coaching to help them with sleep and nutrition? Those are all examples of different service types focused on brain health. And then you want to test within your customer base and your community and iterate and improve yourself as you go along. I do have one way of closing this gap for you. It's called the Brain Health Trainer course. It's currently offered on the Functional Aging Institute's website. It's approved by various continued education providers, and it's been out for about 3 years now. We've trained about 800 health and fitness professionals, And it's about an 8 to 10 hour online self-paced course that you can go through to learn more about the brain, how exercise can affect the brain, what to do about it from an exercise programming standpoint, and what you can do to add cognitive exercises or dual task exercises into your routines. It's been a labor of love. It's how I give back to the world, or one of the ways I give back to the world. And I would love to see you part of this community. If you want more information, you can go to brainhealthtrainer.com or visit the Functional Aging Institute's website. If you do decide to go forward with the Brain Health Trainer course, you can use all caps, all one word, BRAIN200 for $200 off that course. If you want to follow me on the social medias, @glatt.brainhealth. If you wanted to email me about a particular question, you can email me at rglatt8@gmail.com. And earlier I mentioned Ping Pong for Good. It's a nonprofit started by one of our Parkinson's patients. Shout out to Giselle Tamula, who is our Parkinson's nurse practitioner who's on this webinar today. What a beautiful example of interdisciplinary and multidisciplinary care where someone working in neurology wants to learn more about exercise. So we share a patient that actually co-founded this nonprofit called Ping Pong for Good. So I highly recommend you go check that out. And I'm going to stick around for any questions you have. Thank you so much for all your time, your attention, and your passion. And thank you so much for being here today.
All right. Some of you have had your hands up. So let's see. Vicky, that's...
It might be left over from when I asked people to raise.
Oh, I'm sorry. Well, then excuse me. Then anyone who has a question, go for it. Just unmute.
I'm going to go through the chat. I think I saw a couple questions.
Okay.
If someone has the Alzheimer's gene, has there been any recent studies determining a range of years of moderate intense exercise that can delay symptoms? Yes. I'd love to give you a specific number in terms of if you exercise with the prescriptions that I mentioned, that you'll delay it by a certain number of years. But there's the ApoE gene, which is called the Alzheimer's gene. There's ApoE3, there's ApoE4. You can have a 3-3, a 3-4, a 4-4. It depends how many copies of those alleles and which alleles you have. And it depends on a variety of other lifestyle factors. So I can't give you a number, but the research has found that if you have the Alzheimer's genotype and it's in your family, dementia or Alzheimer's specifically, then you exercise, and typically the multimodal 150 to 300 minute prescriptions that I was talking about is going to delay the onset of that. And it's just more encouraging to do that because you're at higher risk. My course does give more specific percentiles, but it has to be within context. Unfortunately, it would take too long to explain the nuances of that. The answer is yes, you can increase the amount of risk reduction percentage that you can have regardless of your genotype, but it does depend. Great question. Where can you find programming for Parkinson's disease? That's a great question. So I've been working with a couple of very smart physical therapists to develop some curriculum for Parkinson's. If you email me, I can send you different links. I think that the Parkinson's Foundation and the Davis Phinney Foundation have some resources for that as well. There's one that is slipping my mind that actually has a free training for fitness professionals for Parkinson's. Just email me and I'll send it to you once I remember it. Ironically, says the memory guy. Thoughts on supplements for brain health, fish oil, etc. It's a dangerous category. The World Health Organization puts supplements at the bottom of their list for evidence-based. However, if we're going to approach it in the correct manner, and in a scientifically responsible manner, things like curcumin, certain types of curcumin that are highly absorbed in the body may be beneficial for brain health. Dr. David Merrill, our center director and a geriatric psychiatrist, did a study on UCLA about that. Fish oil, vitamin D, especially if you have a deficiency, vitamin B12, especially if you have a deficiency, and then just making sure that you're overcoming nutrient deficiencies. Although there's some research saying that nutrient deficiencies don't make a difference. For vitamin D and B12, they seem to have more significant neurological consequences. And so it's important to have those. So yeah, fish oil, curcumin, vitamin D, it's really outside my scope of practice to recommend those. But listing off what's been more in the literature There's ginkgo biloba. There's other ones starting to come out. Lion's mane. I'm not recommending any of those, by the way. Those are just ones that seem to be prominently mentioned when brain health is discussed, and they're typically proven in animal studies. And there's not enough human randomized controlled trials for all of these to really confidently recommend them. Do we have any experience with training for post-concussion, young or old? Could concussions be considered a mild cognitive impairment? Great question. So I actually got into this because of my own concussion. I sought training on concussion management and rehabilitation to kind of play a role as a fitness professional in that area. Certainly there's a lot of shared characteristics with concussion, young or old, prior or recent. There's a lot of considerations. It's not just cognition. It's also vestibular or inner ear, visual, metabolic, autonomic. There's a lot of considerations there. If you want a great resource for concussions, go to concussioncompass.com. And Dr. Molly Parker is a physical therapist, as well as Natasha Wilch. And both of them are PTs that specialize in concussion, that have created a resource for providers and people who have sustained a concussion to learn more and have a community. Concussion is a different set of content. It's acute. It's an acquired brain injury, like a stroke or post-brain tumor. And so there's similarities, but also very unique differences in how we would approach that. People can develop mild cognitive impairment or dementia because it affects the cognitive trajectory. And certainly comprehensive rehabilitation and improving cognitive reserve as it relates to those conditions is really important so that we can offset that. So great question. Do we have any specific guidance for training clients with severe mental illness? Mercedes, go ahead and email me. There's a book called, I think it's called Exercise Prescription for Mental Illness. It's more of a research heavy book, but it goes over all the mental illnesses and the latest research on exercise prescriptions and how to work with those individuals. That's another conversation. I love it because brain health is such a window to different special populations, Parkinson's, MS, concussion, mental illness. It's my goal to start the conversation and then work with smarter and more involved people in those areas to try to get continued education that's high quality into the fitness and health industry on those topics. So that's my next goal once I get my other crap together.
All right. Are there any more questions? We have time for one more.
No pressure. One more question. Wow.
One more question.
Who's gonna get it? Who's gonna get it? Jay, you could ask it.
Oh, you don't want to know? You don't want to hear my question?
Okay.
No, I'm kidding. No, I think it's been a very informative presentation. And I mean this as a compliment. It was easy to follow, and I know that's a challenge. Sometimes it's a challenge for me to follow very technical information, and I know it's a challenge to present it. So yeah, I thought it was terrific.
Thanks so much, Jay. That means a lot coming from you.
Yeah.
This has been an iterative process. It's always been a little awkward for me to find out how to convey this information properly and well and efficiently. And we continue to try to get better at it every time.
Well, you have, so good job.
Appreciate it.
But if there are no other questions, all right. Well, Ryan, thank you very much, everyone. Thanks for showing up. Have a great rest of this summit.
And thank you to FAI for hosting this amazing event. And as Jay said, please enjoy.
Bye, everybody.
Bye now.